Thank you, Madam Chair. In 2019, I introduced the Bipartisan National Suicide Hotline Designation Act, which was signed into law in 2020. Converting from the existing 10-digit number to 988 will make it easier for Americans to get the help they need. And I'm proud of the investments included in the American Rescue Plan to support this transition. Dr. Lockman, as you know, the 988 dialing code will be available nationally for calls, texts, or chat beginning in July 2022. What else should we be doing in Congress right now to make sure that the Lifeline is equipped to facilitate real access to care? And how can we make sure that the Lifeline reaches those in greatest need, including our LGBTQ youth?
Thank you so much for that question, and thank you for your support. As you know, the advent of 988 opens up a whole new opportunity for people to have ready access to mental health care providers and paraprofessionals in ways that they haven't before. There's a couple of things that I think of in terms of what we can do to make sure that we are prepared for this transition. The first one is to make sure that everyone has access on the crisis call line to the very best in training. We know that the science advances so fast, and there needs to be continued training and retraining to make sure we're using the very best practices to take care of people. For example, we rarely use language such as committed suicide anymore because it denotes that it's a crime. Instead, we say died by suicide, and that's important for someone to know. We also talk about things such as it's important to not die, not just for the sake of not dying, but for the sake of having time to transition to recovering the life that you really want to live. So one thing is making sure that there's continued investment and support and making sure that every single person, whether you're the person that they call or that they text, is ready and equipped to provide evidence-based practices, interventions, and the language around suicide-safer care. The other thing that I think about in terms of making sure that everyone is equipped to reach a care provider who cares about them, including our LGBTQ community, is making sure that we are using inclusive language and the messaging around 988 and making sure that everyone knows that they have a safe place to go when they're talking about suicide. We've seen in our own SAMHSA grant programs, including serving this community, that talking about connectedness, talking about mental health wellness, talking about meaningful living, and as others have testified, moving the language more upstream to where everyone has a place to grow and become their very best self. This language is likely as important as talking about reducing suicide. And so thank you for your attention to this very important transition. The third thing I will say is that we need to make sure that we're building out the entire crisis continuum. 988, as we know, is the starting place, but there also are plans to go into making sure that our mobile crisis services are well-equipped and well-trained, and also making sure that we are standing up other crisis infrastructure. For example, there's over 600 CSUs, or crisis stabilization units, operating in the United States right now. That provides a really important and critical part of the crisis continuum to make sure that there is diversion from emergency departments. The emergency departments are wonderful in terms of being able to, when people are well-trained, to address and prevent suicide. But CSUs have a different model. They have a living room model to where you're coming in and treated from a standpoint of recovery from the beginning, and also treated with peer support with a focus on growing and wellness and recovering from suicide or substance abuse or other host of other concerns. So I thank you for your support in making sure that we are building out the entire continuum to make sure that someone reaches someone well-trained who can respond to their immediate need, but also can put them on the path to long-term growth, wellness, and well-being.
Thank you. Dr. Princeton, it sounds like you would like to also reply. Please do.
Thank you. I've spent the last 22 years doing research on suicidal youth, those who are at most risk, and thank you so much for the work you've done to establish 988. It is incredibly important that when folks call, of course, they're getting treatment that's likely to work. We now only have science to support one approach to treatment, and the vast majority of folks are not trained in that approach. It's very, very important that we increase the training of providers. In addition, it's important that we have culturally competent providers so folks are able to call and understand the embeddedness of suicidal thoughts within their communities. When I've done that research, we found that suicidal participants would call 10, 12 outpatient providers and not be able to find anyone who would take their case. We need more people trained in suicide. We need more people trained to deal with the scientifically evidence-based approaches to suicide in particular. Happy to help in any way that we can.